All right, well, I have 2 o'clock. We're going to get things rolling here. I'm just going to turn this off. We are recording, just so everyone knows. Welcome to our joint media briefing with leaders from area hospitals and from the Northwestern Health Unit. Today's session is going to help the media and the public understand the impacts that the respiratory viruses are having on our local hospitals, how services are being affected, and the things that the public can do to protect themselves and support our local healthcare system. So what I'm going to ask of our presenters is let's keep cameras off until you're presenting, and then we'll have whoever is talking have full screen, which will work out better for our media partners, as they're probably going to try and capture this, so the resolution will be better. So thank you. We have a number of people who are joining right now, so I just have to let them in. Admit all. Okay. 1, 2, 3, 4, 5 new people. All right. I'll just quickly repeat because we have some new people who have just joined us. We're going to keep cameras off until it is your turn to present. Thank you very much. All right. Let's start things. We have with us Ray Reset, the President and CEO of Lake of the Woods District Hospital, Doreen Armstrong-Ross, CEO of Dryden Regional. I believe that Dr. Bruce Cook, Chief of Staff from Dryden, is also joining us. We have Dr. Kit Young-Hoon, our Medical Officer of Health at the Northwestern Health Unit, online with us. Julie Loveday, who is the Executive Vice President and CNE of Riverside Healthcare, won't be presenting, but will be available should you have questions. Sula Bow, I don't know if she's made it through yet. The list is long. Sula Bow, of course, the President and CEO of Country Memorial Hospital. She did send us a note saying she was experiencing difficulties with her email, and she's going to try and get through on her phone. And
I'm here.
Oh, wonderful. That's good to hear, Sue. Thank you. And I'm unsure on the list here. Maybe if you could let us know if Douglas Semple, President CEO of Menoyawan, has made it through. Not hearing a response. Sue, would you be willing to kick things off for us, or Kit, would you rather take the ball and go first?
I can go either way, John. I
Okay.
can adapt to go first to give everyone time to adjust, if that makes sense.
Okay, well then, Sue, you can take a breath. We'll start with Dr. Kit Young-Hoon, and then we will hear from our hospital leadership.
First of all, I'd like to thank everyone, including our hospital colleagues, for joining us today to share their perspectives on what they're seeing in the hospital setting. And I'd like to thank the media for their ongoing support. Sorry, I'd like to thank the media for their ongoing support and for attending today's briefing. Locally and provincially, we are seeing an increase in percent positivity for COVID-19 and an increase in institutional outbreaks in our area. In recent weeks in our region, we have seen a rapid increase in hospitalizations and emergency department visits for respiratory illness, particularly for children. We are Based on this information, we are facing a potentially difficult winter season. And now is the time to take action to dampen the surge in respiratory illness that is beginning to occur. Today, I would like to remind and strongly recommend that the public use the prevention measure. I'll start that over. Today, I would like to remind and strongly recommend that the public use the prevention measures that have proven to be effective in preventing illness, hospitalizations, and death from viral illnesses. Masking in indoor public spaces is strongly recommended for everyone, particularly for those who are unwell with a respiratory illness, those who live with someone who is unwell, in situations where it is crowded, and for those who are at high risk of severe outcomes. If you are unwell with respiratory symptoms, like coughing, sneezing, or runny nose, please stay home until symptoms have improved for at least 24 hours. And if you're unwell with gastrointestinal symptoms that could be infectious, again, please stay home until symptoms have improved for at least 48 hours. This prevents the spread of illnesses to others. Those at high risk of severe outcomes may also be eligible for antiviral treatment. If you test positive for COVID-19, visit the Ontario webpage to complete a COVID-19 antiviral treatment screener. If you are eligible for treatment, the screener will provide contact information on who to reach out to. If you do not test positive for COVID-19 but are at high risk of severe outcomes, contact your healthcare provider or dial 811, as there may be other treatments that are available to you, such as Tamiflu for influenza. Vaccinations are a proven method at preventing severe illness, hospitalizations, and deaths from diseases. I encourage the public to stay up to date on vaccinations for COVID-19 and to get your flu shot. It not only protects yourself and others, but also protects our healthcare system. For high-risk individuals, the COVID-19 booster is recommended to be given 3 months after your last dose. If you would like a vaccination for COVID-19 or influenza, visit a local pharmacy, your healthcare provider, or book one of our vaccination clinics at www.nwhu.on.ca. We add spots into our clinics regularly based on demand. So far, we have seen very good uptake at our vaccination clinics, and we would like to thank the public for rolling up their sleeves to protect our communities and the local healthcare system. And finally, please gather outdoors rather than indoors when you can, and remember to wash and sanitize your hands regularly. John, I'll turn it back to you.
Thanks so much, Kit. Thank you for the update. Let's head up to Red Lake and hear from Sue LeBeau, President and CEO. How are things going up in Red Lake?
Hi, thank you very much. We certainly are seeing more respiratory illness in children, and that is a concern. Our docs tell us that the kids that we are seeing are sicker as well, and that we do have both influenza A and RSV in the community. And so that remains a concern. We're often in small or rural hospitals or remote hospitals. We have a limited buffer, and so it's important that people take care of themselves, that they stay home if they're ill, that they do what they can to prevent illness, if at all possible, by masking and limiting gathering. We are often 1 or 2 sick calls away, either physician or staffing wise, from having to close. So very important to protect our patients and our community and our healthcare providers. And so we encourage people to take the precautions that they need, get vaccinated, and follow the recommendations of the Northwest Health Unit.
Thanks so much, Sue. We'll head south to Lake of the Woods District Hospital and hear from President and CEO Ray Reset.
Good afternoon, everyone. It's a real pleasure to be part of this event where we can share information. My camera isn't on. It's on my screen, but can everybody see me?
Yes, we can.
Okay, great. Thank you. Yeah, so I think this is a long journey with COVID. In some ways, Some people, I think, feel that it's all over, and many people are just trying to live with it. And as a hospital, we're no different. You know, it really has never gone away from our lives here, and we'll do everything we can to serve the public as we go through this challenge. If I just look at our situation, just say look at October and look at November. In October, about 14% of our visits coming to Emerge were for children under the age of 16. And if I look at just the first 2 weeks in November, not only are our emergency visits up, but 25% of those visits are now children. And most of the children coming are for, you know, significant respiratory distress. So that's really what we're going to face. And we're just getting into the beginning of whatever surge is coming our way. I think the challenge with the pandemic is that each phase and each wave that we go through challenges us in different ways. And at this particular phase, you know, we're expecting, you know, for the first time having RSV, influenza, and COVID all peaking around the same time, which is going to put a lot of strain on the health system and certainly the hospital side. And we're doing that at the same time where we're at the lowest in our staffing because of the health human resource challenges that played out during the last year or so of the pandemic. So this will be a new challenge with a significant wave and less staff to deal with than at any point in our pandemic. You know, so our challenge really is to you know, work with the community. I think through all the phases of the pandemic, certainly that I can reflect on, the community has always been there to keep themselves safe and to try and keep pressure off of the health system. And I think, you know, one of the reasons why we've done very well is because of high vaccination rates in our area and the public doing everything that they could as their part of being in the community. And again, we need to go back to the things that worked. You know, I know that mask mandates probably are not going to come back because they're very hard to bring back, but we can choose our own mandate as an individual, and we can choose to mask and do things like that kept us safe during the pandemic, because really that's the only way we're going to be able to manage this wave. So I would just say from my point of view, you know, we will do everything we can to serve our community. You know, our goal really is to maintain all our services, and if we can manage this wave of the pandemic, we'll have a much better shot at keeping all our services open to serve our community. Thank you.
Thank you, Ray, and thank you for flipping your schedule around to be able to join us today. Let's head over to Dryden. We have Doreen Armstrong-Ross, CEO, and we have Dr. Bruce Cook, who is the Chief of Staff. So Doreen, I'll let you take it away.
Hi, thank you, everyone. So much like our neighbors, we are seeing increased respiratory illness in our community, both COVID, flu, and RSV as well. We have the same staffing challenges as Ray mentioned in Dryden as well, and it's very important that our community gets vaccinated, wears masks, and does what they can to protect themselves and then the vulnerable of our community, as well as the hospital capacity. I'm going to ask Bruce to jump into about what we're seeing in the ER and some recommendations we have for the community. We are going to be putting a lot of information out on our social media in the next couple days of, you know, how to deal with respiratory illnesses at home, treatments, that sort of thing. But we do really want to appeal to the public that if you're sick but you're not needing medical attention, don't come to the hospital and ERs. We really, the waits are going to be long. We are having to prioritize care for the sickest that come in, and we will continue to do that. We are, we still have our assessment center in Dryden open, and we're going to, we encourage use of that, and we'll be putting that information back out to the public so they know that that service is still available in our community and a really good place if you're not sick enough for the ER, but you want some support and some advice from some healthcare professionals. So I think I'll leave it there and I'll turn it over to Dr. Cook.
Thank you. So I would agree with Doreen. In the past week, if not 2 weeks, we've definitely seen a significant uptick in the amount of respiratory illnesses coming to our emergency department. We are, through testing, we know that we are still seeing COVID and we are seeing much more influenza A. We are treating these both COVID and influenza A as when they're indicated, but Doreen really got the message there out that if you can manage your respiratory illness at home and you do not need oxygen or other medical attention, it is best that you stay at home and not go out in the community. And also, if you can avoid the emergency department, it's beneficial as well for those. We are going to see people that are need to be seen, but also we're going to be triaging everyone, so the most ill will be seen first. So there can be a significant wait and waiting in our lobby. So the message, I mean, staying at home is important, but also, as Doreen said, accessing our COVID assessment center is still a possibility and is recommended as well to avoid the congestion in our emergency department. With this uptick in respiratory illness, we have had to transfer some patients out to tertiary care centers, so this is serious. And we want to see those patients that have serious illnesses, absolutely. So, this is really good that we can make everyone aware of what's going on in our community. The respiratory illnesses are here. We are seeing a mixture of 3 very significant viruses, and we want to see those who are the most sick. So thanks very much.
Thank you for that update, Dr. Cook and Doreen. We appreciate that from Dryden. We are going to turn it over now to the media. If there are questions that you wish to put forth, just put up your hand through the system, and we will try and get everyone in order. Just a reminder that also Julie Loveday, Executive Vice President and CNE of Riverside Healthcare, is with us and can answer questions if there's a Fort Frances perspective that anyone wants. Lee, I see your hand up. Why don't you take it away?
Hi, my question is for Dr. Kit Young Hung. Pardon if I'm pronouncing that wrong. In particular, could you mentioned there's been a rapid increase recently. I'm just wondering if you can put numbers to that. Increase of how much and over what time span?
Emergency room department visits for our entire region have increased fairly rapidly over the past 2 weeks. So the 7-day average is about 14% for our region at this time.
I'm sorry, so that's 14% more than what it was?
Of emergency room department visits being related to respiratory illness.
And how does that compare to prior?
So we do compare the numbers to previous years. Now, yes, it is compared to previous years, and so generally compared to previous years' data, it is much higher than what we've seen in the past. Now, I feel like I have to go and verify that information exactly for you how many years we've looked back. So I can look at that if you want to while you while other questions come up, and I can just give it to you in the chats if that makes sense.
Sure, that would be helpful. Thank you.
Yeah.
And if I could just get in a second question to all of the hospital representatives except Kenora, do you have comparable numbers to what we got from Mr. Reset in terms of the increase in children in your ERs? And how many of those are respiratory cases?
Haley, it's Doreen. We do know we have some. I can get probably numbers for you. I don't have those here available to me, but definitely we are seeing sicker kids than we have in quite some time.
Okay, thanks.
All right. I don't see any other hands up. I'm guessing there's going to be more questions than just the one. Lee, I'll get you just to turn your mic off. Thank you. I'll give it a 10-second window here, and if there are no further questions, then we can wrap things up. Yes, Kit.
Yeah, sorry about that. I just want to emphasize that the surge we're seeing in respiratory illness, it's the beginning of the surge. It is earlier than normal. Like many of the previous speakers have mentioned, it's a combination of a variety of viruses that are occurring at the same time. It's impacting the entire province. And there are a number of pediatric hospitals that are very negatively impacted, and that affects all of us because we are reliant on them as tertiary centers, as specialized pediatric hospitals, which we don't have in our region, and so therefore some of our patients and clients do need that service as well. So it does. So the rates are much higher than what we normally see at this time of year. And higher than right now, what we're seeing is similar to the peak we've seen in previous years, but some of the jurisdictions in Southern Ontario are seeing even higher peaks. So it is a situation that we have not seen for at least, I have data going back to 2017. So this is not seen for over 5 years. And therefore it has the potential to have a drastic impact on the healthcare system. So just trying to answer these questions, make sure in a really fulsome way, in case that wasn't clear. Thank you.
All right, thanks, Kit. And Lee, I see you have a follow-up. Go ahead.
Thank you. Can I just can I ask you to try and quantify sort of the level of concern here? Like, I don't know if you can try and use sort of like, you know, the red, orange, yellow alert system or something like that, but like how worried are you right now?
I am very worried. This is a surge that is overwhelming hospitals in an area of Ontario where they have more capacity than we do. And we are in a region where capacity is, historically lower within the healthcare system. And as some of the presenters have mentioned, the healthcare sector is less resilient now because we've been bombarded with illness after wave of illnesses after illness and COVID over the past 2 years. And then of course there's the historical ongoing staffing issues as it relates to recruitment and retention that is worse. So combining all those factors together, we do have a situation that can be very, very difficult in the upcoming months. And so we are bringing forward clear recommendations that individuals should be making the effort to screen, stay home if they're sick, mask in indoor public settings, get vaccinated, and consider treatment if you are eligible. I see a couple of hands up.
Yeah, let's let Sue go first, and then we'll follow up with Doreen.
Thank you. I would concur. I'm very worried as well. In my long career as a nurse and then as an administrator, I have never seen a hospital, a tertiary care pediatric hospital having to open an extra critical care unit for pediatric patients, like has happened recently. My other concern is the fact that hospitals are sending 14 and 15-year-olds to adult critical care units. So those are signs that all is not the usual in pediatrics for sure. And, you know, it may signal a wave in adult populations later. But this is something that I've not seen. Oh yeah, I can. There we go. So I would concur. I am very concerned. In my career, in my long career as a nurse and as administrator, I have never seen a hospital, a pediatric hospital, have to open a critical care, an extra critical care unit, like has happened recently. And I have also not seen 14 and 15-year-olds being routinely sent to an adult critical care unit. So it may be a harbinger of a wave for adults, I don't know, but it is a concern to see that. And that in my 25 plus years is unprecedented.
Thank you for that, Sue. We'll move on to Doreen.
Hi, thank you. And I was going to say something very similar, Sue, as this is a very concerning situation. Certainly never this early, as Kit mentioned, have we seen this level of flu activity. And when we see hospitals already in the province, our tertiary centers that we do send patients to, having to go to the measures they're going to care for their patients, put warnings out to the community about wait times in their ERs. It's very concerning to us. And the Ontario health system is, works together very closely. And when we know beds are getting filled in these tertiary centers, that it's going to back up the whole system. And with the situation we're in, it's just a very concerning situation. And and that's why we're all here today, to really implore our communities to do everything they can, whether there's mandates or not, to prevent the spread of these respiratory diseases, because it's an extremely concerning situation. And much like at the beginning of the pandemic, other things happen as well. People still have heart attacks and strokes and those sorts of things, accidents and whatnot, that need to be cared for. So there has to be capacity in the system to care for the normal things that go on with people outside these enormous surges of three in particular respiratory illnesses that we're dealing with right now. So it is a very concerning situation.
Thank you, Doreen. We'll move over and hear from Ray.
Yeah, so just a couple of other factors I would throw in. I mean, recently we know that Northwestern Ontario was closed for access to pediatrics intensive care unit in Winnipeg because of an outbreak of RSV from Nunavut that occupied their unit, and that was early. We were even before this particular wave that was playing out. So it just shows how quickly a major center like that everybody depends on can suddenly become, unavailable. And that's the challenge that we're getting into, and we're not really into anywhere near what this is going to really look like. And when we look at other waves, I talked about some things that we've never faced before. Not having mandates is a significant issue because they're very hard to bring back once they're stopped. But we did have mandates that we could rely on for the other phases, and we don't on this one. So that's another difference too that we have to contend with. So so I think I would go back to really what kept us safe, and remind the public of the great work that we did together to stay safe. And I think that what doesn't get discussed either is the impact on say our physicians. I mean, just the effort to try and keep our emerge open. We had 22 physicians last year, and this year we have 12, trying to keep that department open. Well, we've been going through that for several months So we also have tired staff, hospital staff, physicians, and all of that. And then, you know, this is what we have to face this last big challenge, probably of the pandemic, will be this particular surge. So, you know, I think there's tremendous character in our hospitals to serve the community. We really need people to go back, though, to what kept everybody safe in those earlier phases of the pandemic, because you're not going to get mandated, but we would ask you to seriously consider that as a way of protecting you and your families, and protecting our capacity, because we do need it for people who require service. And if we get overwhelmed, you know, there will be people who need service that won't get it. And that's what I worry about the most.
Thank you, Ray. Doreen, is that a legacy hand up, or did you have something else to add? Okay, thank you. Not seeing any more hands up, we'll give it a last call here. And not seeing any hands up, I want to thank everyone, media and our guests, for joining us today. We had Sulabo, President and CEO from Red Lake, Ray Reset, President and CEO from Lake of the Woods District, and Doreen Armstrong-Ross from Dryden Regional, as well as Dr. Bruce Cook. We had Dr. Young Hoon from the Northwestern Health Unit, and thank you to Julie Loveday for connecting with us as well, Executive VP and CNE at Riverside Healthcare. Thank you, everyone. Have a great day. We're going to be putting this onto YouTube as quickly as possible, and sending out the link to everyone to use as they so desire. So thank you, and have a great day, everyone.
Thank you.
Thank you.